All right, man. Thanks so much for joining. I want to just introduce, let you know ahead of time we are recording this so that we can put
Okay.
this out there for folks. I want to thank you for joining me today to talk about everything we got going on in terms of COVID-19. I've been doing a little Instagram live thing a few days, just bringing on different folks, but kind of want to formalize it here and do a Zoom meeting and have a more in depth and longer discussion. Is more important too, just given the recent developments and the things that you've been dealing with personally with your own family, with your mother. And we had this meeting scheduled before. We had this video conference scheduled before that even took place. But the fact is, I hope your mother's doing well. Hope things are getting better. But now that
Good.
gets us something very important to talk about, as we know. Across the country, not just in Milwaukee, not just in Madison, or even the state of Wisconsin for that matter, the disproportionate impact on African American communities is very real. But what it does is highlight a lot of the bigger issues that we've been dealing with for generations. A lot of the inequality that has long persisted, whether it's income inequality, whether it's environmental factors that exist, or access to quality and affordable health care. And
Right.
all these things are being played out right now. We see all this come to a head. We see how COVID-19 is ravishing the nation, but it's also exposing so much of the inequality that's existed for far too long. These are things that we've tried to talk about forever when it comes to disparities in health outcomes. And, a lot of that fell on deaf ears for a really long time. And now we see how people are losing their lives. People are being unnecessarily burdened, unfortunately burdened. People's health and safety is being compromised. But with that being said, I just want to introduce everybody to Reverend Pastor Marcus Allen from Mount Zion Baptist Church in Madison, Wisconsin. So
Oh
I
yeah.
get to introduce yourself and tell a little bit about what's going on and some things that you're looking to do, because we did have a phone conversation a couple weeks ago where we talked about how we can be more proactive about this, how we can be good stewards, how we can do some community education to get people up to speed and up to date and recognize what these challenges are and how we overcome those challenges. So
Right.
with that, I'm
Okay. I'm Reverend Dr. Marcus Allen. I'm the pastor of Mount Zion Baptist Church in Madison, Wisconsin. I've been there since October 2016. It's a church that's one of the second oldest African American church in the city of Madison, and the largest African American church in the city. Uh, as you stated a few weeks ago, I appreciate you. I want to say thank you to you and your office ultimately for doing the faith-based conference calls to allow faith leaders to be able to talk to you. And when about a few weeks ago, I was saying on the news or not even on the news, I was just saying it on Facebook, how I was saying that the people that were dying were Black people. So I emailed you all and said, hey, what are statistics saying? Are Black people dying at a higher rate than any other race? And I think about a week later, the numbers started to come out, because I think Milwaukee is one of the only cities that are really tracking numbers by demographics. That's what they were saying. And our people, we were saying, we can't get it. Our immune system can handle this. We came through the Middle Passage. We've been through slavery, and we can't get this virus. This is a white people virus. So that's what we were hearing, and some people were taking it to heart. Some people believe what Facebook actually says and think it is true,
a
and
lot.
that and that what was happening.
Mhm.
And so, like I said, and then you reached out and said, how can we talk to our people and have them aware of what's going on? And then just this week, a load of rocks really fell on me, a burden that my mom was diagnosed with COVID-19. My aunt diagnosed with COVID-19, and then just Monday, my younger sister has also been diagnosed with COVID-19. And so because of that, knowing, one, I was already in tune, trying to check it, one, I was trying to make sure my church was safe, make sure they was aware. So I've been flooding them with information about things, but I really wasn't doing any research on this COVID-19, how it's affecting people and what was really going on, because, I guess I'm gonna be honest, it just hadn't affected anyone directly as of yet. But then this last week, it was tough, man. I'm telling you, it was tough.
Yeah.
I talked to my mom every day, and every day it sounded like she was getting worse and worse. So it was real difficult to just hear that from her. And then now I'm just doing research of what happened in her case. I'm really saddened by. Can I speak on that?
Oh, yeah, please.
Okay. I was just really saddened by how the medical system really treated her. She has pre-existing conditions, and she went to the doctor back in March 19th, March 31st, and had a video conference on April 6th, and was never told that she may have this virus. Never told. She's showing she had shortness of breath, a severe cough. She had an earache. She had lost her sense of taste and smell, and she had a fever. All the symptoms CDC have on their website that I would have thought to at least let her know this is what you need to do when you go home. So that didn't happen. And then my mom, we called 911 in Milwaukee to come get my mom because she was having extreme shortness of breath, and the fire department come, and they failed to take her to the hospital. And so just then now I'm trying to get reasoning behind some of their actions. And of course, Aurora suggests they're not testing people unless they're having shortness of breath. And I guess at the time on the 6th, when my mom talked to her doctor, she didn't have shortness of breath. So that's what I'm learning from this. And I'm also learning, if you feel you have any of the symptoms, take care of yourself at home. That's what they're telling people. But I think we need to make people aware of what they should be doing to take care of themselves at home.
Yeah.
I'm also understanding from my family, people don't watch the news. Some of the young people don't watch the news. They get all their information from Facebook or from Instagram or anything, but they're not watching the news to see what's going on, how you should be handling yourself, what you should be doing, because you get more information, I think, from the news rather than from social media device. So I think we need to make that push that awareness a little bit more of what you should be doing while you're at home. Because also I talked to the lady from Aurora, their quality assurance, and just trying to figure out what happened with my mom case. And she's saying that more people are dying at home than they are at the hospital. And they're trying to look at the reasonings for that now, but they don't have all the research. But so I really need to know, what should we be telling our people? Because we're saying, don't go to the doctor, don't go to the hospital. Well, what should we be doing while we're at home? So that's public health, the state public health, they have some things on their website. I just shared it on my Facebook.
Thank you for sharing that.
Platform so people can know, and trying to get it out. I'm developing an email now to send to all of my members of my church, and I'm also the president of the African American Council of Churches. So I'm gonna send the same email to them so they can share with all their people that if you're at home, this is what you need to be doing while you're at home if you're showing any of the symptoms. I'm also telling them, hey, no one should be in your house but you and your family that lives there. And you shouldn't go to anyone else's house because
or people, I mean, hanging out with people that you know.
Right. Our people say, we've been hanging out way before this, so we gonna keep hanging out. No, that's not good, because you don't know where that person been, you don't know who they were around, and now you're allowing them to come into your house and they may have this virus. So that's what I'm telling my people. Only people in your house, the people that live there, or people you know where they've been when they were not in your house. So don't you go to nobody else's house, because you don't know what's going on in the house. Because I'm hearing about, through my cousins that live in Milwaukee, that they're having house parties, they're having kickbacks, get-togethers, they're having Monopoly. What? Come on, we are in this disease. This disease is so serious. I've witnessed the effects of it.
Yeah.
The way it attacks your respiratory system is like none other. My mom, even the way she sleep, with the way she tried to lay, it caused pain on her lungs just by the way she had to lay in the bed. And people not taking it serious. And I want to be a voice now, a loud voice now, even the more, to tell people to take it serious, because if you don't die, you're going to go through some painful stuff while you're trying to navigate through this disease.
Yeah, and I appreciate that too, and I appreciate you getting all that information out as much as you can. And one thing too, like you mentioned about things you saw on Facebook, I know we talked about that on the phone, where you mentioned folks talking about we survived Middle Passage, we survived slavery, but that discounts how many people died in the Middle Passage. That discounts how many people died during slavery, and I never looked towards that time, and I don't want to go back to a struggle I don't need to go through, and I don't think anybody deserves to have to go through that, especially a lot of our vulnerable populations. These are our relatives, and very literally, as you've experienced. And also, as a pastor, warning comes before destruction. And people, we see firsthand what is happening. And I just, I hate the fact that so many people are ignoring these guidelines. And it's the same thing, right? It's like you think that you're young, you think you're invincible, you think you can get through anything, you think that it won't get you. And in many instances, it may not. But it's more about the other people who are around you, who are not as resilient as you are, whose immune system is not as strong as yours is. And if you do you have a couple of the things that were on the website that you've been sharing, the information you've been sharing? I'm not sure if you have it readily available or not.
Yeah.
Things you want to share.
I've been sharing 3 things. One, let me pull it up right here. What to do if you come in contact with someone with the COVID. What to do if you're home and you're sick. And it's just saying, no, stay home, separate yourself from people and animals, avoid sharing personal items in your home, wash your hands, and then don't go anywhere. So that's if you've been exposed to somebody. I think the same principle will apply if you have the virus, you're at home. So it's isolating yourself, it's staying to yourself, it's washing your hands, it's sanitizing everything around you. And then I want to add this, at least they have self-monitoring too. If you got a cough, difficult breathing, that's one of the 4 symptoms that CDC suggests seek emergency aid immediately. If you have shortness of breath, if you have pressure in your chest, if your lips are bluish, and I forget the 4th one. But like I said, I've been trying to do some research now, but that's according to CDC. If you have those symptoms, you need to go to the emergency room immediately. But if you have a fever and a cough, and I forget the 3rd one, you can stay at home, but you need to call your primary care doctor. And also, Lieutenant Governor, this, and I want to say this, oftentimes we're not completely honest with our primary care doctors. So you need to tell them about everything that you are experiencing, no matter if you're saying your toe ache, your arm ache, whatever it is, with everything that you are experiencing, you need to let them know, because many primary care doctors have not allowed you to come in. They have to do a consultation over the phone. So if they're doing it over the phone, or even if you go in, you need to tell them everything that is going on with you and everything that is happening in your body. And I think that is that's very important for people who have symptoms, who are at home, and you got to isolate yourself. You can't be around people. You got to stay in your own room, and if you have to share a bathroom, I think you're gonna have to at least sanitize it after you come out of it. So if you're sharing home with someone, then you can't spread it. So I think that's the goal, because it spreads so fast, and I don't know how easy it is. I don't know. I know they say 6 feet. I don't know what causes spread. I don't know any of that, but it spreads so fast. So people need to be very conscious of who they're around and what they're doing when they're around people, and continue to keep that safe distance, continue to quarantine in place. I told my family, we all right up here, because I don't go anywhere.
Yeah.
I stay at the house. Now we have a food pantry at the church, so I go and I help with that to give our food to people, and we're giving food to students through our school system, and our church has partnered with MMSD to give food out. So I go with them sometimes, but I'm masked up. I have on gloves. I even put on the hat and the hoodie. I don't know why. But
hey, look, you got to take every necessary precaution.
put on hat and hoodie, everything, get on a mask, have on my gloves, and go out. But we set up a process to eliminate much personal contact with people, even doing that. But also contact. I think Milwaukee has 211 where they can call if they're feeling some symptoms, and if they don't have like a medical primary care or something, they can call 211, or they can go on the Milwaukee Public Health website and get the number, and it has a coronavirus hotline with triage nurses that would talk to them about what's going on and the symptoms that they're having. So I think, and then I also put a link, I forget the name of the link, but it's a link that the Department of Health from the state has where people can do assessment also, where they can go and they can be able to assess themselves. But they also put their information in, and a triage nurse will return the call to them if they're experiencing any of the symptoms. And I tell people, I want to tell, we're speaking to people now, that if you're experiencing any of the symptoms, call somebody. Let them know what you're feeling, and then stay at home. I think they're saying hydrate, try to get rest, and drink hot liquids. I don't know. Everybody don't know. They're telling people to stay at home, but what to do while you're at home, no one really knows what to do. So everybody come up with these different remedies and stuff. But I know they said, like they told my mom, take Tylenol and take hot liquids and drink and hydrate yourself a lot. As you was talking about, like African American people, also I was talking to someone today. They said, hey, we've been mistreated for 400 years. Now we're being failed to be treated at all. So we definitely want our people, if you're having the symptoms, if you're feeling some type of way, and I'm learning this from my mom's situation, don't stop calling your primary care or somebody. Call them every day if necessary, twice a day. This is what I'm feeling. This is how I'm feeling. And make sure someone is hearing your voice, because a lesson I learned while in the United States Army, nobody will take care of you like you can take care of yourself. And we can't put the total responsibility on healthcare providers to make sure we're safe, like anything. Like if you know you have heart problems, you know you need to stop eating certain things, stop putting certain things in your body. You got to take the proper precautions if you want to live. And if you want to live, you got to call these people, let them know how you're feeling, let them know your temperature, checking your temperature, and all those sorts of things to make sure you're saving your own life in this time where people, even medical professionals, really don't know what to do. When my mom tested positive, the first thing they told her, we don't have a cure. That's some sad words, right? That's some sadness.
Very frightening.
Yeah, very frightening. The first thing they tell her, yo, we don't have a cure. So you have this disease, but we don't have a cure for it. But these are some things we're going to do to try to make you feel better. So people, you got to take care of yourself before you get to that point. You got to protect yourself. Stay at home. Do not come out of your house unless you go into the grocery store to get something you need. And I think a lot of grocery stores have set it up where you can order your groceries online and go pick it up. If you need food, I'm pretty sure it's a lot of agencies now that are receiving a lot of funding. Let me say that. They're receiving a lot of funding to help people who are in need. And I know in Madison, we have 211 where you can call and get with United Way. And then I know Boys and Girls has a lot of stuff, and they're doing a lot of things for a lot of people. And then some of the churches too, programs we have in place to help people in need, because a lot of people too, Lieutenant Governor, they're trying to survive and they're trying to live. So they got to get out in these streets and try to make things happen. But we know we're receiving a lot of government funding. We're seeing a lot of stuff being funded in, funneled into our communities. And so people need to call for help. Call somebody for help. Don't go out there and put your life on the line. I know at Mount Zion, we've been taking food to people's houses. They call us or they email us or they send us a Facebook. We take to the food, put it on the steps or open the door and just give it to them. So people are trying to find ways to live during this pandemic. Now that's honest. That's truthful. People are trying to find a way to live, but there are programs that have been set up to help people. And people shouldn't feel as if they're alone. They shouldn't feel as if they can't get what they need. I know things been set up for people won't have to be evicted. People won't have to be kicked out of home. So I think that's a lot too that plays a part why people are in the streets also, that they're trying to still make a living. And I think I don't know if I can talk about it, but hey, I'm here now. One industry that's suffering greatest is our cosmetology industry. Many of them are normally self-employed, and I know many of them are taking chances, going into people's houses, doing hair, cutting hair, and things like that. But if we had some things put in place, and I think we do, to how to support these people, and I think we really need some help to make sure to also keep people from out of each other's homes and keep people from the streets, is to make sure they can be able to provide for the basic needs and necessities for living.
Yeah, and that's the thing too. I mean, if the federal government can come up with I want to say $25 billion for the airline industry. They can come up with a sum of money for, people who are, independent contractors like barbers and hairstylists and other people who are participating in the gig economy where life is just so much less certain for them at this point in time. And two things you mentioned. You said there's a link, the Wisconsin Department of Health website. So I want to encourage people to visit dhs.wisconsin.gov for up-to-date information. That website has the total number of COVID-19 cases, the number of deaths, the number of people who have had negative test results, and also has a number of hospitalizations as well. And there are other useful links for people on that website. And another thing you mentioned was, you said for 400 years, African Americans, Black people have been mistreated in this country, and now not being treated at all. And it's like the same thing as the saying, when America gets a cold, Black community gets the flu. And now that the world is essentially getting the flu, we see Black people are dying. And that is a very real thing. This is about saving people's lives. And I just want to reiterate how much we need you, people like you. One, you're a younger person. Two, you're a faith leader, and people are counting on you. People are dependent on you. You see stories across the country about congregations of all different faiths that are sort of ignoring a lot of these guidelines. And at the end of the day, you got to ask yourself, is it worth it? And I don't think that it is worth it. We have to be responsible. And I thank you for even approaching me about setting up these calls for faith leaders. It was you. It was you reached out to me, brought it to my attention that this is something we should be doing, and getting that information out there. I just want to thank the people who willingly gone along, and the leaders in the faith community who even out. We didn't even request this, but they went out, like I can say, I want to say Interfaith, Council of Churches, number of organizations put out a statement that supported these safer at home guidelines. Because what good does it do if you convene a congregation, everybody ends up getting sick, and then people start dying? That is your responsibility. If people in your congregation die because you wanted to defy these orders, and it's not easy, and it's not easy for a whole lot of people. I don't think there's necessarily, there aren't a whole bunch of industries that are exempt from the pain that that COVID-19 has brought about. You see the economy being impacted. You see democracy itself being impacted, especially with the catastrophe that was last week's election, with people who were leaving their house to go vote, with city of Milwaukee going from 180 polling locations to 5, which essentially could have created a hotbed for transmission. Now, we don't know how that's going to play out. There was social distancing. People did have on PPE gear, and the impact of that remains to be seen. But no election should have been carried out in that way. And then healthcare, the healthcare system being overrun, but it's also exposing the flaws that exist in healthcare. If people had better access to health insurance, health care, in rural communities where it could be extremely difficult to get to a doctor's office. Now, we see slower rates of transmission there because the population is more sparse. However, in the event that somebody does come down with the infection, with the disease, it may be a tough task for folks to even get to a doctor or just a regular doctor's visit. And I want to give a special, shout out to our federally qualified health centers out there that are doing the Lord's work, that are working with the most vulnerable and marginalized populations. All our health professionals who are on the front lines, all the people who are doing the work. There's a lot of people, a long list of folks that deserve accolades, and that we want to congratulate. Once we get on the other side of this, we're going to be happy to do so. But it requires us all to take those necessary steps and to make the sacrifices that are going to make us stronger in the end. We have a responsibility, all of us, government, faith, private industry, nonprofits, you name it. And, I appreciate you. My thoughts and prayers are certainly with your mother, your sister, your entire family, as I cannot imagine how frightening that experience had to have been for you.
Right.
Knowing that.
I cried my tears, man, for real.
I'm sure.
I'm a strong man of faith. My mom is where I got it from, so she's extremely stronger than I am. But I'm glad she's doing better. And
yes.
Like you said about church coming together, the first week when the NBA shut down, Mount Zion shut down.
Okay.
We didn't wait for the Safe at Home. So I think we're on either week 6 or 7. I done lost track. I think we're on either week 6 or 7 where we haven't been together. Okay. And I was trying to. I think I even emailed your office and say, hey, can we do parking lot worship? And then we even got a clearance this week, and I was like, nah, because I knew what my mom was going through.
Yeah,
I don't want my members to go through that same thing. And I didn't want to be responsible for helping the spread of this most deadly virus that we haven't seen, this pandemic that we've seen. So, but no, also like you stated, economics, everything. Many churches are hurting the same way because most of our giving comes from our members, and I don't approve, but I'm pretty sure some was trying to figure out how do we get people together to make sure we can pay our mortgage or we can take care of our staff, because churches have staff people too that they don't want to lay off because of this. And we want to stay faithful to our people. And then we also have, many churches have programs that help the community, food pantries, schools, daycares, and all of this stuff is also a part of the church. But oftentimes, I know the churches, people don't look at us as an entity that's essential for the community in which we're in. And so we see support small businesses, support businesses, support these other people, but rarely do we hear, hey, I also support the local church. And so I think that plays a part in some of the decision making of those pastors. I'm only 37 years old, and trying to manage in this, man, I can only imagine what you're going through because you're on a way higher level than me. But trying to manage church and managing the processes in which we need to go by, how do we move forward? How do we get church online? How do we make sure we're in contact with our members who don't have a cell phone? It's 2020. They don't have cell phones. They don't have internet. They only have a house phone. And people, that's how they're living. So how do we stay in contact with those people, with our seniors? So our church has been very creative and very trying to do things to make sure we're staying in contact with our members, people in our community. It's tough, but like you said, I think our world, I think the church is going to be so much better after this. It's going to be so much better. And preferably the community can see the need for the church and see how valued the church is for the community. We often state, we want to be a safe haven for people. We want to be a hospital for sick people. And it was challenging, so challenging for me to say, we're not going to have worship. I don't know if you saw it, but it was a big debate on social media of pastor who was faithful and fearful. You were faithful if you had church. You were fearful if you canceled church. So that was challenging. You understand what I'm saying? But I knew it took more faith to say, hey, you all stay at home, than it did to say, hey, we're still coming to church. So I think preferably everybody's getting the message and understanding the severity and how how easily this thing can spread. Hope pastors are recognizing it, that it's not worth it. You know, do
Yeah.
a conference call your people, and you just talk to them through a conference call, or you don't have to have major technology to be able to reach your people. If you have a smartphone that can record, just go live or record it and send it out to your people. Don't try to bring your people together. It's so uncertain. If we have professionals who really don't know about this stuff, why would we say, hey, we're going to commit to still bringing our people together? Right now, my church, we're developing a plan, because I know at some point we're going to be able to come back together, but things will not be the same when we come back together. So we're trying to develop a plan. How re-entry would be? How will we have a fellowship period where we shake everybody's hand? Will we pass the offering tray, or will we have people walk around or deposit in their own means? So we're trying to figure that out because we have a pretty large congregation. Should we have more services so we can split up the amount of people that come in to worship? So we're trying to figure that out, and I know we'll be getting more guidance from different arenas of how should we be doing that. Now, I don't know when, but I know we need to be prepared for it when it does happen. So it's challenging, man, and for many it's fearful, but we're committed. I thank you again, man. Thank you again for being so touchable, to be able to reach out to you, and then not only do you hear me, but you put actions behind your words. So I really do appreciate it.
Man, I really appreciate you, man, and I appreciate you joining me. Thanks for everything that you're doing, whether it's the food pantry, whether it's being proactive and making sure that you're keeping your congregation, your people safe, and just getting that word out there, being a good steward, and truly living out the word, truly living out your faith by doing the right thing to protect folks. So, obviously it's gonna be the last time we talk. So look forward to talking to you soon. Look forward to visiting you when this is all said and done. And don't hesitate to reach out as things come up, and give your family my love.
Thank you so very much. Praying for you also and the decisions you're making, and everyone in your staff. You have a wonderful staff too. That they communicate with me and get back to you. So I really do appreciate that so very much.
All right, man. Well, thanks again.
All right. God bless.
All right. Bless you too. Talk to you soon.
Yes, sir.